Hi everyone, my name is Rebecca Donnelly. I am going to provide a presentation and introduction on infusion devices today. I hope that you find it helpful, and here we go. The initial step prior to any infusion will always be to verify the physician orders, check the patient MAR, and the patient allergy list. Here we see that the physician orders are for a primary IV bag, which is a 100 milliliter bag of normal saline to be delivered at 125 milliliters per hour over the next 8 hours. There is another order for a secondary bag or IV mini bag for clindamycin, which is a concentration of 600 milligrams in a 50 milliliter bag of normal saline, and we are to deliver that over the next 30 minutes. We also see here there is an order to flush the triple lumen catheter with all the medication administrations per the facility protocol. We also see here that the patient has no known drug allergies according to the MAR. If it is possible, always ask the patient prior to administering any medications for any other known drug allergies. The next step will be to gather the medications and all the medication supplies. So we're going to obtain the necessary supplies, inspect the primary IV bag for clarity and expiration date, as well as prime the IV tubing. To turn on the IV pump and open the door to load the IV tubing, you will use the side clamp by inserting it into the top of the IV pump as shown above, and that will both turn on the pump and open the door. Ensure the side clamp is positioned on the tubing so there's enough space between the side clamp and the roller clamp. You'll begin loading the tubing as shown here. You'll press the tubing into each of the sections following the instructions on the screen. Start by loading section 1, then 2, and then 3, and ensure that there is a green check mark for each section indicating the tubing has been loaded properly. Once you have loaded each section and the green check marks are shown above on the screen for each of the sections, you can close the door, leave the side clamp engaged until you're ready to start the infusion. Next, the screen will show several options of designated units or departments. In this example, we'll choose Medical Surgical Department. Most pumps will have specific medication options programmed for various units. Use the arrow keys to move through the selections and then hit OK. Then you'll use a numerical keypad and begin typing the medication you wish to choose. In this example, we're going to use IV plain for IV normal saline. Next, you're going to enter the rate of milliliters per hour, again using the numerical keypad. Then you'll choose OK on the keypad. Next, you're going to enter the volume to be infused. In this example, we're going to use 245 milliliters as the volume to be infused instead of using 250 mLs, which may put the patient at risk because the IV bag will run empty and their air will get into the tubing. Once you're ready to begin the infusion, now that you're ready to begin the infusion, you can choose Run on the infusion pump. Again, you'll have one more safety check. The screen will prompt you to ensure that all clamps are open, there are no kinks in the tubing, and that there are drops running in the chamber. Once So I'm just going to take some time now to talk about some of the common alarms that you may see and hear. We'll just review a couple of these on the next slide. So we'll just review how to troubleshoot a few of those alarms that are the most common. Air in line could mean the bags run empty, so could be from a programming error, could mean that there's air bubbles in the line that you need to aspirate somehow, either with an empty syringe, just expelling it from one of the Y sites. A downstream occlusion may occur. You'll also want to just ensure that there's no closed clamps again. There might be kinks in the tubing, maybe the positioning of the catheter, IV catheter. Explore other sources that could be, the part of the occlusion. Upstream occlusion may occur above the pump. This can occur due to a closed air vent, which some types of tubing have. Propofol, which is an anesthetic that is used for patients who must be sedated while on a vent or right after major surgery, is in a glass IV bottle, so it requires a special tubing with an air vent. So those are just a few of the. So preventing the alarms from sounding is key because it's going to avoid interruptions for you as a nurse and for the patient. So you'll always want to be sure that the tubing is primed properly, ensure there's no air in the tubing. You always want to make sure the IV bag is not really cold or really hot. Never shake the IV bag. If it's a mixed bag, just invert it gently to mix it. Always fill the drip chamber about halfway and no more. You'll always want to make sure the IV pump is clean and dry, especially that tubing channel area. Always avoid empty IV containers by setting the volume to be infused properly. And then always plug in your IV pump into an outlet if possible to avoid that low battery alarm. All right, and on to the next presentation. We'll start with the secondary IV bag, loading that into the IV pump. Thank you.